Today, we will be looking at the iceberg of mental disorders and phobias. I have categorized them from most known to least known, not most dangerous to least dangerous, so that's why a lot of things might have weird placement. Without further waiting, let's dig into the iceberg of mental illnesses and phobias.
Arachnophobia is categorized as a mental illness and phobia, and it is the extreme and irrational fear of spiders. When people with this see a spider, they are likely to either back away or attempt to kill it from a safe distance. Spiders are completely harmless, so this is an irrational fear.
Claustrophobia is the intense fear of enclosed spaces, like elevators, caves, closets, washing machines, etc. A prominent example of what might scare them would be the Nutty Putty Cave incident, where a man got stuck head first in a narrow opening, tragically dying before help could arrive. About 12.5% of the worldwide population have claustrophobia.
ADHD, or attention deficit/hyperactivity disorder, is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity, which can significantly impact daily life and functioning. ADHD is a common disorder, and considered a disability. It is commonly self-diagnosed, which is not possible, but sure. Why not? Phasmophobia, not the game, is the extreme and irrational fear of ghosts. Anything ghost-related, haunted mansions, cemeteries proclaimed to be haunted with the ghost of the dead, horror movies in general, anything haunted with ghosts or ghouls would scare them. This can cause panic attacks when exposed. The strange thing is sometimes they know the fear is irrational, and yet still cannot get over the fear. OCD, or obsessive-compulsive disorder, is a mental disorder condition characterized by intrusive, unwanted thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, that individuals feel compelled to perform to reduce anxiety. It causes significant anxiety or distress. Individuals with OCD find these thoughts difficult to control and experience intense anxiety when they occur. Examples include fear of germs, fear of harming oneself or others, intrusive sexual or violent thoughts, excessive focus on religious or moral ideas, need for symmetry or dementia is a mental illness umbrella term including Alzheimer's, Lewy body, vascular, Huntington's, and more, and it classifies a general term for a decline in mental ability, affecting memory, thinking, and behavior, and interfering with daily life. In general, it is caused by damage to the brain cells, and it is progressive and irreversible. Unlike popular belief, it is not common to old age, though it gets more common as you get older. Early diagnosis can help.
Bipolar disorder is a mental disorder that results in a rapidly shifting mood, from intense highs, mania or hypermania, to lows, depression, affecting energy, thinking, behavior, and sleep. There are different types of bipolar. Bipolar 1, where at least one manic episode happens. Bipolar 2, where at least one manic and one depressive episode happens. And cyclothymic disorder, cyclothymia, characterized by periods of hypermanic symptoms and periods of depressive symptoms, but not severe enough to meet the criteria for a full episode. It can also be called manic depression.
Acrophobia is the specific phobia characterized by an intense, irrational fear of heights that can lead to significant distress and avoidance behaviors. Examples include skyscrapers, elevators, balconies, multi-story houses, airplanes, skydiving, paradiving, etc. It can cause panic attacks. Like all phobias, while the exact causes are not fully understood, acrophobia is believed to be linked to a combination of genetic, environmental, and psychological factors. While a natural apprehension of heights is normal, acrophobia involves an irrational and disproportionate fear that significantly impacts a person's life. Necrophobia is a specific phobia, the irrational fear of dead organisms as well as things associated with death. With all types of emotions, obsession with death becomes evident in both fascination and objectification. This includes human corpses, any carrion being decaying animal flesh, bones, etc. Obviously, it can cause panic attacks, but strangely, also fascination with the topic. Exposure therapy also obviously doesn't exist, luckily.
Gonna go fancy on you verily? I say unto you, ophidiophobia, the fear of snakes, can cause great distress and anxiety when one encounters these serpents, or even their likeness. In correlation with this fear, some may also experience herpetophobia, a broader fear of reptiles. Examples include the titan boa, garter snakes, or any snake in general. Avoiding places where these creatures might be present, such as parks, hiking trails, or even certain rooms in the house, would be common for those with a more severe case of this fear.
Trypanophobia, not to be confused with trypophobia, is the specific extreme and irrational fear of needles and other medical procedures of that likeness. This includes IV bags, vaccines, blood transfusions, severely affecting medical procedures, and life for that human. As vaccines are extremely important for all sorts of reasons. Besides the core fear, symptoms can include panic attacks, dizziness, fainting, increased heart rate, and difficulty breathing. Trypanophobia is closely related to other needle phobias, but it specifically focuses on the medical context of needles. While it's more common in children, it can persist into adulthood, and some estimates suggest it affects a significant portion.
Thanatophobia, which I could not find anything on, so I believe the iceberg meant thanatophobia, is the intense fear of dying, or the dying process. People may fear their own death, the death of others, or the dying process itself. While common, thanatophobia isn't officially recognized as a distinct mental health disorder by the American Psychiatric Association. Triggers can include discussing death, witnessing death, or encountering situations related to death. The fear can interfere with sleep, work, relationships, and overall enjoyment of life. Tryptophobia is a fear or strong aversion to tightly packed or clustered holes, patterns, or protrusions. It's not a recognized mental health disorder in the DSM-5, but many people experiencing it find that images or objects with these characteristics cause them distress. The name comes from the Greek word trypo, meaning hole. Others propose that the visual characteristics of clustered holes, like high contrast and spatial frequency, trigger a specific emotional response. Seeing or thinking about clusters of holes can trigger feelings of disgust, anxiety, nausea, and even panic attacks. Depression is a very common mental illness that causes extreme sadness, usually after a traumatic event, like a family member or pet dying. It can affect anyone at any age, but it's more common in women. Symptoms include sadness, loss of interest, hopelessness, low self-esteem, fatigue, disturbed sleep, or changes in appetite. This can be caused by the previously mentioned bipolar disorder, schizophrenia, and many other mental illnesses, can also result in depression. Speaking of schizophrenia is a mental illness characterized by psychosis, including auditory and visual hallucinations, negative emotions, as well as disorganized thinking and/or behavior. It can also cause a less severe version of dementia, difficulties with memory. Research suggests that schizophrenia may be linked to differences in brain structure and function, particularly in areas responsible for higher-level cognitive processes. Schizophrenia has a strong genetic component, meaning that individuals with a family history of the disorder are at higher risk. All forms. What is binge eating disorder? Binge eating is when you eat a large amount of food in a short amount of time and feel you can't control what or how much you are eating. If you binge eat regularly, at least once a week for 3 months, you may have binge eating disorder. Please tell me. Repeatedly consuming more calories than you burn can cause you to become overweight and eventually obese. This, in turn, can increase your risk of cancer and other chronic health problems, such as diabetes and hypertension. PTSD, post-traumatic stress disorder, is a mental health condition that can develop after experiencing or witnessing a traumatic event. Symptoms can include flashbacks, nightmares, intrusive thoughts, avoidance of trauma-related stimuli, and changes in mood and thinking. PTSD can develop after experiencing or witnessing a traumatic event, and it can be influenced by factors like the severity and duration of the trauma, a person's history of trauma, and genetics. Mysophobia, also known as germophobia, is the intense and irrational fear of germs, like dirt, boogers, mud, practically any public area, and more. It can be linked to OCD, obsessive-compulsive disorder. Moral mysophobia is a ritual of cleanliness and avoidant behavior due to unpleasant obsessive thoughts. Causes of mysophobia range from environmental, i.e., product of one's experiences, to genetic, e.g., parents had similar phobia or were highly anxious.
Skipping psychosis, electorophobia, is the extremely irrational fear of chickens and can be a specific phobia. It can manifest as intense anxiety, panic attacks, and avoidance of situations involving chickens. Possible causes include negative experiences, genetics, and learned behavior from parents. People with this will avoid chicken coops, eggs, roosters, chickens, hens, all that good stuff. No omelets for you, electorophobia.
Gonna go past both of these quickly. Necrophilia is the sexual attraction to dead people, which is absolutely disgusting, and masochism is the sexual arousement to pain. Now, anatodophobia, one hell of a name, is the extreme and irrational fear that somewhere, somehow, a duck or silly goose is watching you. Causes include past traumatic experiences, such as being bitten or frightened by a duck or silly goose as a child. Anatodophobia is not a recognized psychological condition, for obvious reasons. Agoraphobia is an anxiety disorder characterized by intense fear and anxiety in situations where escape might be difficult or help unavailable. Usually colliding with claustrophobia, examples include stuck elevators, collapsing caves, a burning house, buses, trains, planes, or other modes of public transport, open areas like parking lots, marketplaces, or parks, or being alone in unfamiliar or public spaces. Agoraphobia can develop as a complication of panic disorder, where individuals become fearful of having another panic attack in certain situations. Schizoaffective disorder is a mental health condition where individuals experience a combination of symptoms from schizophrenia, such as hallucinations and delusions, along with mood disorder symptoms like depression or mania. It's a chronic condition, meaning it's long-lasting and can often be managed but not cured. Treatment typically involves a combination of medications, therapy, and support services to manage symptoms and improve quality of life. The disorder features both psychotic symptoms, like hallucinations and delusions, characteristic of schizophrenia, and mood disorder symptoms, like depression or mania. Panic disorder is a mental illness which makes panic attacks significantly more frequent and usually severe. Panic attacks are classified by a sudden wave of fear or discomfort, or a sense of losing control, even when there is no clear danger or trigger. Just because you have a panic attack doesn't mean you have panic disorder. Luckily, panic disorder is highly and easily treatable. This tends to affect day-to-day life majorly. Having random panic attacks isn't exactly the best way to spend a day. Hexaconta-hexaphobia, dear God that name, is the extremely irrational fear of the number sequence 666. This is because 666 is usually correlated as the devil's number, sorta like 3 a.m. is the witch's hour. This fear can be rooted in religious beliefs, superstition, or exposure to the number's depiction in popular culture. This is one of the rarest phobias in the world, along with the fear of opening your eyes and anatidophobia. Pretty silly. Imposter syndrome is the extremely rare mental illness where, even when having undeniable proof otherwise, the affected person will believe they are a fraud, lacking in competence, or deserving of their success. This can lead to feelings of self-doubt, anxiety, and a fear of being exposed as a fraud. And that can lead to intrusive thoughts. Individuals struggle to internalize their successes and may attribute them to luck, good timing, or external factors. While it can negatively impact mental health, imposter syndrome is not a mental health diagnosis in itself, unfortunately. Cotard's delusion, also known as eternal dreaming or walking corpse syndrome, is the extremely rare mental disorder where the affected person believes they are either dead or eternally dreaming. This results in reckless stunts, refusal to drink or eat, severe hallucinations and delusions, and death within 2 weeks if not treated. It can appear in less severe and more common, but still extraordinarily rare cases where patients believe they have lost a limb, organ, or vital bone. It was named after Jules Cotard, a man who believed he was dead, stating, "A ghost doesn't need insulin," confirming he believed he was dead. Truman's delusion, famously named after the hit movie The Truman Show, is an extremely rare delusion that makes the affected person believe they are in a live-action movie or show where they are the main character. The widespread use of social media and the constant monitoring of online activity can also fuel suspicions of being watched. This can cause individuals to engage in unusual behaviors, such as seeking to be the focus of attention, fearing public scrutiny, or even believing they are being watched or filmed, making irrational decisions. Apotemnophilia, also known as body integrity identity disorder, BIID, is a condition characterized by a strong, persistent desire for the amputation of a healthy limb or other bodily part. This can be extremely dangerous when exposed to a sharp object, sharp enough to cut bone, as it can result in severe damage or death. While some studies have explored potential sexual components, it's important to note that apotemnophilia is not a paraphilia, and the desire for amputation is not necessarily related to sexual arousal. Alien hand syndrome, AHS, is a neurological disorder where a person's hand moves involuntarily and seemingly against their will, often feeling as if it's not their own. Since this is so rare, I will give an individual case of it. Following brain surgery to treat epilepsy, Karen Burns' left hand began exhibiting behaviors that were not under her conscious direction, such as unbuttoning her blouse or stubbing out cigarettes. The surgery, which split the corpus callosum, the connection between the brain hemispheres, is thought to have contributed to this condition. Alice in the Wonderland syndrome, also known simply as Todd syndrome, is a rare neurological condition where individuals experience distortions in how they perceive their own body and the surrounding world. This can include distortions in how big, macroscopic, or small something is, microscopic, similar to the one makes you larger and one makes you small, referenced in the movie Alice in Wonderland. Time also may seem to be moving out of sync, like the White Rabbit's watch. Alice in Wonderland syndrome episodes usually only last between 3 to 30 minutes, but remember the time distortion. Certain illicit substances have been linked to AIWS. It was unsurprisingly named after Lewis Carroll's hit book Alice in Wonderland. DDD, depersonalization derealization disorder, is a common but lesser-known disorder that results in a detachment to oneself. Depersonalization and a detachment to one's reality they reside in. Derealization. Individuals with DDD experience a sense of unreality, feeling like they are watching their life from a distance, like an astral projection, or that the world around them is distorted. Strangely, people with DDD tend to feel knowingness that these thoughts that fly inside their heads are not real. Coro is the usually culturally bound disorder where people primarily found in East and Southeast Asia believe their private parts are retracting into their body and causing death. This belief is a core symptom of Coro and is often associated with feelings of shame, guilt, and fear. Hormonal changes could potentially also cause Coro to develop. This, for obvious reasons, only occurs in men. In some cases, Coro outbreaks have been associated with socioeconomic upheaval or economic uncertainty. Fregoli syndrome is the extremely delusional belief that multiple strangers on the street are actually the same person, but in disguise, often with the intention of persecuting them. It is a type of highly delusional misidentification disorder, similar to Capgras syndrome, the belief that someone you love has been replaced with an imposter. It can be linked to a breakdown in the ability to recognize uniqueness in individuals, leading to a hyper-familiarization of strangers. Intermetamorphosis is a different variant of Fregoli syndrome, involves the belief that strangers and familiar people are constantly swapping identities, maintaining their original appearances. Clinical lycanthropy is another misidentification disorder where the affected individual believes they have transformed most commonly to a wolf, but occasionally any other animal. Do not mistake furries with this. It is most commonly associated with things like schizophrenia, bipolar disorder, or both combined, schizoaffective disorder. Examples include a 12-year-old boy believed he was transforming into a wolf while looking in the mirror, experiencing visual delusions like changing eye color and teeth length, and a 24-year-old man believed he was a cat and spent time with cats, acting like them. Clinical zoanthropy is practically the same thing. Diogenes disorder, Jaj syndrome, is the behavioral disorder which causes self-neglect, intense hoarding, and extreme social withdrawal, more commonly seen in older people. It's named after ancient Greek human Diogenes. People with this are usually unaware that anything is wrong, making it extremely hard to get help. Their home is usually in a state of disrepair due to the extreme self-neglect. Diogenes syndrome is often linked to other mental health conditions, including dementia, psychosis, alcohol abuse, and OCD. Before we continue, if you made it this far, you clearly enjoyed the video, so please consider liking and subscribing. Next time, I am doing physical illnesses. Now, anorexia nervosa is the extreme mental illness defined by the restriction of nutrient intake relative to requirements, which leads to significantly low body weight. Approximately 5% of people diagnosed unalive within 4 years due to either sudden death or cardiovascular problems. Patients with this eating disorder will have a fear of gaining weight along and a distorted body image with the inability to comprehend the seriousness of their condition. Borderline personality disorder, BPD, is a mental illness that involves emotional instability, impulsive behaviors, and relationship problems. People with BPD may also have an unstable sense of self. Other names for BPD: emotionally unstable personality disorder, EUPD, emotional intensity disorder, EID, and borderline pattern personality disorder, borderline pattern PD. Causes: extreme mood swings, intense anger, feelings of emptiness, and difficulty controlling emotions,